going to be full-time engagement starting next week. And I have my colleagues here to do this to you. My name is Twile Justus, and in my practice I have seen many people suffer from lack of information and skills, and this affects their attitudes and practices within their communities. So I wanted to make a difference in these people. I wanted to contribute in health promotion and disease prevention. A chance came in 2023 when I got a sponsorship to go and study in Korea through Korean Foundation for International Healthcare called KOFIH. And from this exposure, I learned best ways to make a difference in my community using limited resources.
So the virus I've taught you is called what? HPV.
When I returned to Uganda, I found KOFIH was requesting for proposals from medical workers that had gone to Korea for training.
I divide this project launch it.
This seemed as an opportunity, but I was a bit scared. Do I have enough time? Do I have enough team? The concept was not yet clear with me. I knew the problem, but the solution needed to be organized. First, I approached KOFIH offices and met the country director and program director, and as well as Sarah, the coordinator of the project. They advised me and we came up with a clear idea. In this idea, we were to use e-content to improve basic health in Uganda, focusing on cervical cancer, nutrition, first aid and WASH. Because of limited funds, we needed to select an area to implement this project. There were many areas in Uganda which needed this project and badly in need of this project. We selected Namanve because this industrial area has young population, and these people come from hard-to-reach communities of the country, and they are characterized by low literacy levels, and they are very, very poor. And so they normally work as casual laborers, and they work from morning up to evening. They don't have time to go and have healthcare checks or healthcare services, and they stay in poor conditions in slum areas around Namanve, and their children actually attend schools which are surrounding Namanve. And so we knew by impacting Namanve industrial area and surrounding communities, we will have impacted a greater community, and we had learned that this whole environment has over 200,000 people. And so we thought that these little resources could impact a big, wider community.
So, like I've told you, everyone here is at risk of getting this virus because we've said one of the causes is multiple sexual partners, kissing, holding hands with the person with this virus.
Our biggest challenge were to get permission to involve schools, industries, ministries. We got clearance from MOH, which is Ministry of Health, district health officers, and schools and industries. And actually, Chinese industries were not allowing us entry. They feared that we were ministry officials who were against what they were doing. We conducted a baseline study to understand the exact challenges they were facing and came up with content to use. The content was to be produced in posters, signages, audiobooks, videos, and also offer direct services to the people in form of medical camp. This was another biggest challenge because the people of Namanve said they needed real people, not animation. Also requested for movie or drama for some of the topics and wanted them in a simple language and in a way easy to understand.
This is an antibody, this is an antibody, this is an antibody, this is an antibody. Previously, the one I showed you had one antibody, but when they give you the vaccine, they add you more what? Antibodies to fight this virus.
We needed all these in a short period of time, so selecting a good team that was committed was so important.
Start. Then put it in the neck of the tie your friend. Wow.
We sat and wrote scripts, purchased the required things for the videos, hired the fine art people, and as well as graphic design people. We worked days and nights and produced the work.
What I want to say is, above all, before you touch all those dairy cans, you need to wash your hands with clean running water and soap.
We trained the champions and peer educators. Then we delivered posters and signages which we had completed to schools and industries. Then we provided medical services through the camps. We did blood donation drives. We trained using e-contents that we had made. I remember going on a music drive in the community looking for the people to attend the camp. We did a music drive to look for the people to participate. We needed to get permission for the workers to leave their industries. It was a bit tricky, and actually open mobilization in this setup proved a bit tricky. We had our first camp and at the Lagan Dot in Namanve, and in attendance were the program manager of KOFIH and the representative of the Lagan Dot. After this camp, we learned lessons, and the preceding camps we did through independent industries. We went to East African Medical Vitals, Roofings, Galaxy Ken Industries, and as well as New Hope Secondary School. There was great interest in the teaching and skills we provided. People put signages in the compound. Also, using our books, and all our social medias are active, and people consumed vaccines, gained knowledge. People gave blood, and we screened for most common diseases such as cervical cancer, prostate cancer. We had laboratory services including HIV, hepatitis, syphilis, malaria. We also measured blood pressure, hypertension. 2,000 people benefited from this project. Surprisingly, many people had hypertension and diabetes and did not know, as well as many people had cancers. The problem was the fund was not enough. We could not finish all the industries. Up to now, they are calling us to go to these schools and industries. We believe with more funding in future, we can impact people around Uganda, and we hope that the trained champions and peer educators can continue to use the e-contents to pass on knowledge to the people. The project might have ended, but the impact will be long felt.
Thank you for this chance. I was saying, once you are given this vaccine, it's like you have recruited UPDF to guard your home. In case of any intruder, the guards are there to fight against them.
Thank you, the funders and all the stakeholders.
Raise awareness. Content.